The Trump-backed redistricting plan is just one of many ways the Trump administration is remaking the way government operates. Many in local governments are struggling to even understand, where it may all be going. Today, state, local, and federal lawmakers met at the Santa Clara County Government Center for a community meeting to talk about the coming impacts of the big, beautiful bill. John Ramos has the story.
President Trump signed his so-called Big Beautiful Budget bill on July 4th, and today local leaders gathered to discuss just how ugly things could get for Santa Clara County as a result of it. Santa Clara County has the highest and most diverse population in the Bay Area, so when you talk about the biggest human impact at the county level, you're talking about health care.
They run the second biggest hospital system in the state. A very large percentage of their revenue is from the Medicaid program, which has been drastically reduced in the so-called Big Beautiful Bill. We need to talk about how we can prevent worst-case scenarios.
Congressmember Zoe Lofgren was one of many elected officials who spoke at the community meeting organized by Santa Clara Supervisor Betty Yoon.
There are severe detrimental cuts, and I don't think even the word cuts is an accurate portrayal of the level of gutting and the decimation of our nation's public health care system.
You will face crowded emergency rooms, longer wait times for health care services because of the ripple effects of H.R. 1.
At this point, the full impact of the budget law is hard to quantify. Opponents say even if Medicaid coverage isn't directly cut, access to health care will get harder as the system itself is shrunk by defunding.
It's scary. It's a dumpster fire every other day for us in the disability community.
Michelle Mashburn is a disability rights advocate who says she has no doubt that the cuts will lead to deaths within her community.
There are people that wait to get on disability benefits that can no longer work, that become unhoused, and then they die. There are many people waiting for benefits that die. There are family members that will lose the supports that they need to take care of their kids. People will be institutionalized, and those institutions are being defunded also. So the care and services available, they're inhumane. They're not just. And with these cuts, that's what's going to happen more.
The law also includes cuts to housing and food assistance, but at the same time, ICE will be getting a gigantic increase in funding, making it the largest law enforcement agency in the country. State Assembly member Ash Kalra sees a dark motive behind that.
Tens of billions going into ICE is basically for Trump to create his own Gestapo that he can enforce and do whatever he wants. He's starting by taking over DC right now. He's already made efforts in LA and other places. We have to be very honest about what's happening right now. Immigrants are being used as a scapegoat. We must focus on protecting our immigrant community, but we have to recognize it's not going to stop with our immigrant communities.
Congressmember Sam Liccardo says California can do what it can, but ultimately there is no way for the state to replace what is being taken away.
The truth is there's no entity that can supplant trillions of dollars, and that's what we're talking about, literally $1 trillion in Medicaid funding.
The Democrats are pinning their hopes on the 2026 midterm election to return control of Congress back to them. But Liccardo thinks it's possible there could be breaks in the Republican ranks even before then.
We're going to see these impacts nationally, and as the impacts start to roll out, I expect you're going to see more of those colleagues of mine with wobbly knees, and that will be our opportunity. And then maybe this conversation will be much more fruitful about, hey, how can we actually reverse some of this damage?
The Republicans know that, so they've timed the major cuts to the healthcare system to kick in a month after the election. That's why local leaders aren't waiting to get the word out to the voters about what's coming for them.